should we make today? 5 million. How much do we?
Hello, good evening, everyone. How are you, everybody? My name is Mr. Alan, and welcome to our Facebook Live on Next Generation NCLEX. So, for tonight, we'll be discussing some practice questions on Next Generation, and hopefully, you will learn something tonight. So, before anything else, I would like to introduce myself. My name is Mr. Alan Matus, and I am a nurse educator. I've been helping nurses for so many years, and I also am a an author. So I publish a book in Amazon that you can buy, and then also I've been an NCLEX specialist. I've been teaching nurses how to pass the NCLEX for so many years. Now, before anything else, also I would like to show some of the announcements that we have for tonight. It's Thursday. So we have our 10-day live comprehensive NCLEX review webinar schedule. That will be on starting July 15 to September 16, 2023. That will be every Saturday from 8 to 4:30 p.m. This program is for U.S. and foreign graduates. So if you would like to refresh your content for NCLEX, we offer this class every Saturday from 8 to 4:30 p.m. So feel free to send us a message if you're interested, everybody. Okay. Okay, another one. Let me see. Okay. So we also have our self-study comprehensive online NCLEX review course. So we have an online NCLEX review. Everybody knows that. So I have my pre-recorded videos that you could watch, and also it comes with a workbook. So it's a self-study comprehensive online NCLEX review with interactive core content review, highly organized and up-to-date test plan-based curriculum. Also, we have a study plan calendar and hundreds of end of lessons NCLEX quizzes, and of course, final NCLEX predictor assessment exams, and our Facebook Live video recordings. You can also watch them. All right, so another one. Of course, we have an ongoing promo this time. Pass your NCLEX in 30 days, get our NCLEX Success Workbook. If you buy the NCLEX Success Workbook, which is $99.50, it includes free shipping within the US and the Philippines, and also you will get 3 months of self-study online NCLEX review for free. Normally, everything will cost you around, let's say, $250, but because of our promo, you're gonna pay only $99.50, and that would be free shipping. So this is really an affordable NCLEX review program, very comprehensive, and you can also read our testimonials, our students who would attest about their experiences about the review and how they were able to pass their NCLEX examination. Also, I have my book in Amazon. It's a content review book. The next edition is coming up soon, maybe in the next few months with the next generation NCLEX discussion. But for now, this edition really focuses on content review. You can buy that in Amazon, and I think the price right now is somewhere in the 50 something. Also, if you're international, you could also buy from Amazon, and Amazon can deliver internationally, of course. So that's the book, and then we also have the workbook. So the workbook and the book have the same content. It's just really the format. So when you review online, of course, you're going to have the workbook for the online, so that while you're reviewing, you will be writing the information, which makes the review, of course, highly interactive. Hi, Joe. How are you? Good evening. All right. So another one. Okay. So we also have, of course, I would like to ask everyone to share and subscribe. I know it's a little bit late, so we only have a few people watching right now, but hopefully later on you will all catch up, everybody's, because I have prepared good questions for your next gen tonight. So share and subscribe. Share this with your friends who wants to get information more about your next generation NCLEX. And then, of course, let's review a little bit about your NCLEX, your next gen. So again, as a reminder, you have 85 questions minimum with a maximum questions of 150 items. You will have 15 non-scored questions, and you have a maximum of 5 hours to finish the examination. And then you will have three case studies, three NGN case studies with 6 questions each. That would be a total of 18 given before the first 85 questions. And then the exam is still mostly composed of classic question formats. So meaning that out of 150 questions, if in case you get 150 questions, 18 of those will be coming from the case studies. So mostly your NCLEX is still composed of the old NCLEX questions. So do not think that your NCLEX has changed 100%. As I've said, NCLEX only added your NGN questions. And the good thing now is that you will have partial credit points for some question types. Shimaya, thank you for being here tonight and for purchasing. What did you purchase, Shimaya? The workbook or the book? Are you in a program also right now? I think so. Yeah, you enrolled in the program. And hopefully you like the online academy. Okay, so we have the cognitive levels from the National Council for State Boards of Nursing Clinical Judgment Measurement Model. So again, as a review, the next generation questions have been added to the NCLEX, and you have case studies having 6 questions. And these questions will test your ability to recognize cues, analyze cues. Some questions will be about prioritizing your hypothesis, generating solutions or taking action, generating solutions, and then you have taking actions, and then evaluating outcomes, of course. So it's almost like a nursing process. Um, so, as we discuss some of the questions tonight, or our example questions tonight, I'll be telling you what kind of area of the clinical judgment model you're being tested on. Again, as a review, your standalone item types, there's a lot of them. So I think there's no need to memorize all of these item types, but just be aware of them. Okay, so the extended multiple response or select all that apply, the select in, matrix, of course, the drag and drop, which is your closer rational, then the drop down, the highlighting, the bow tie, and the trend question. So I'll be giving you examples of this for tonight. So I have prepared like 2 questions. So let's see. Then of course your scoring models for the next generation NCLEX. So for your next gen questions, remember you will have 18 of those, right? 18 questions. So the scoring models will be either you will have a 0-1 scoring, meaning a 0-1 scoring means that you will just get credit points for your correct answer for the question. Now, the plus minus scoring is the correct minus wrong, which usually applies to select all that apply questions. And the rational scoring, which is making sure that you get the information correct for cause and effect relationship. So rational scoring is a scoring wherein you need to be able to get two answers correctly. So one of these sessions, I'll be giving you examples of the rational scoring. Okay. So the question now is, everybody, are you ready for our next generation NCLEX session? Can you please say yes in the chat box, guys? Okay. I would like to welcome the following people who came in tonight. Okay, thank you. All right, so let's see who just came in tonight. Mami Lors, Joe, and then newest comments. Let me see. Shemaya, and we have a lot of people watching actually now, so it increased. Okay, so that's good. All right, awesome. Okay, so let's have the first question, everyone. We don't really have a lot of questions for next gen, and the reason for that is because it's case study. The next time you join our next gen, I would encourage that you use a laptop because with the next generation questions, there's just really a lot of words. So I would encourage you to use a laptop so that you can see the case study. Okay. All right. So let's have the first case study, everybody. All right. Our quick session for tonight. So the nurse in the emergency department is caring for a 59-year-old client. The nurse's notes. The client is admitted due to sudden blurring of vision and half-sided weakness with paresthesia of the left arm and fingers. The client is alert but has episodes of confusion. Speech difficulty is noted. There's complaints of double vision and mild headache, rated 6 over 10 on the numerical rating scale. The client has a long history of stage 2 hypertension and angina pectoris, smokes 4 packs of cigarettes per day, and the vital signs are temperature 37 degrees centigrade or 98.6 degrees Fahrenheit. The blood pressure is 150 over 60. The heart rate is 99. Respiration is 16 breaths per minute. The pulse oximetry reading is 92% and oxygen at 4 liters per minute via nasal cannula. So the question is select the 5 client findings that require immediate follow-up. So which means to say that you have to go back to the case study and then you really have to read. For example, number 1 is asking you about temperature. So you have to go back to the case study if the temperature is normal or abnormal. Okay. And then also you have your blood pressure, you have your vision, respiratory rate, the body weakness, paresthesia, and your pulse oximetry reading. Now, again, what you have to do is be very careful. So as you read the question, you have to go back and forth to the case study, right? And hopefully you can see really the items, everyone, because I know the letters are a little bit small, but this is the actual format of your next generation question. The format is really like this. You know, when you look at the samples from the National Council for State Boards of Nursing, this is how your next generation question looks like. Okay. All right, so I'll give you a little bit of time to process the case study and give your answer in the chat box, everyone. Okay, in the comment section. You have to select 5 only, everybody. You cannot select 3, you cannot select 4, but you have to select 5. So in this question, you cannot skip. It has to be 5 out of 7. And for this question, everyone, the scoring for this is the scoring for this, everybody, is the 0-1 scoring method. the 0 1 scoring method, which means to say that you just collect points for your correct answers. Okay, you're collecting points for your correct answer for this question. So it's a 0 1 scoring. This is not correct minus wrong. Okay. And I understand that it takes a while for you to get your answer, because you really have to go back and check the case study and look at the values, especially. But again, the good news for this next generation question is that you get partial credits, which means to say, even if you get one wrong, you can still get credit for the ones that you have correct. Again, this is not a correct minus wrong question, okay? Because every time you see like you're able to select only five or three or four, if it limits the amount of questions that you can answer, then that's not a correct minus wrong question. Okay, so this one, you just select five, and then let's see how many you get. Okay, out of five. So I think everybody already has put their answers. Let's see. So the answer to this question, everyone, let's see. All right. So this question is what you call extended multiple response question, or select all that apply. Select all that apply, but with dash or dash n. Dash n means that it only allows you to select a certain number of items. Select five only. Okay, so let's see the answer, everybody. Let's see if you get it right. Very good. So the answer is going to be blood pressure. Why is blood pressure included? Because the blood pressure is 150 over 60. Yeah, that's really high. Your vision also, because there's blurring of vision. Body weakness, because there's half-sided weakness with paresthesia. And then also you have your pulse oximetry reading, which is 92%. Now, very good. Congratulations for all of you guys. You got five, I guess. All right. Now, but the one thing I would like you to remember here is in the next generation NCLEX, you will have questions like this. That's only one. You call it a standalone item. Or you can have a case study with 6 questions. Now, probably, if you have to ask yourself, what condition is happening to this patient, guys? What do you think is happening to this patient? With sudden blurring of vision and half-sided weakness. Um, Client is alert but has episodes of confusion, double vision, mild headache. This is actually a question. It's testing your skill, which is your recognizing cues. Recognize cues, so meaning that you have all of those items there, and then you have to figure out what are the cues, because as nurses we're supposed to be able to identify anything that is abnormal. So this is the first step, the area that you're being tested, recognizing cues. Now let's go to the next question, because the next question will be about the type of question that you will have, that I will give you next, is going to be the analyzing the cues. So after you have recognized the cues, then you have to analyze, right? You have to analyze what's going on with this patient. So you have to see and find out what's going on. So let's have analyzing cues. Okay, answer this next question. This is testing your analyzing cues. And as a nurse, you have to start thinking what's going on with your patient. Okay, so the nurse in the emergency department is caring for a 59-year-old client again. So you have the same situation. Okay, the same situation, 10 o'clock, admitted due to sudden blurring of vision and half-sided weakness with paresthesia of the left arm and fingers. The client is alert but has episodes of confusion. Speech difficulty is noted. Complaints of double vision and mild headache, rated 6 over 10 on the numerical rating scale. Has a long history of stage 2 hypertension and angina pectoris again. Smokes 4 packs of cigarettes per day. The same vital signs, that will be temperature of 37 degrees, 98.6 degrees Fahrenheit. Your blood pressure is 150 over 60. The heart rate is 99. Respiration is 16. The pulse oximetry reading is 92%. Now, this type of question is testing your ability to analyze cues. And This type of question is a matrix question. Matrix question. So, multiple choice matrix. So, for each client finding below, click to specify if the finding is consistent with a cerebrovascular accident, Bell's palsy, or trigeminal neuralgia. Each finding may support more than one disease process. So, meaning in this question, number one, guys, in this question, you're able to mark every row. You can mark CVA, Bell's palsy, trigeminal neuralgia. So you have the freedom to, to check everything. But always remember, the scoring for this question is going to be correct minus wrong. So be very careful. This is correct minus wrong, or that would be your plus, or that would be your plus minus. Okay, or that would be your plus minus. Okay, minus. So be very careful. What you can do as you answer this is you type, for example, facial drooping, and then you put in the comment section if it's a CVA, Bell's palsy, or trigeminal neuralgia. That's what you can do. If it's severe facial pain, then you say CVA, Bell's palsy, or trigeminal neuralgia. So you can type them one by one. So this is a plus minus scoring rule, which means to say that this is correct minus wrong. So you cannot check everything because not everything will be correct here. Okay? So this is correct minus wrong. So you can put, so everybody, can you put your answer facial drooping? What is facial drooping? Let's go with the first row. What's your answer, everyone? Is that for CVA, Bell's palsy, trigeminal neuralgia? Okay. So let's go to number one first. Let's be organized. Let's see. Let's wait for the others. Okay. And then you can put also severe facial pain. Where can you find severe facial pain? CVA, Bell's palsy, or trigeminal neuralgia? Because as a nurse, you're analyzing your cues, right? You're analyzing your cues, trying to rule out possibilities, that is this Bell's palsy that's going on with my patient? Is this trigeminal neuralgia, or is this CVA that's going on? So number two, you have severe facial pain. Okay, what about number three, arm weakness? What do you think is arm weakness, guys? Arm weakness. Would that be CVA, Bell's palsy, or trigeminal neuralgia? Okay. Arm weakness. So you can write the word arm weakness and then slash or dash, You can do that. Then you have your slurred speech. Slurred speech, is that CVA, Bell's palsy, or CVA, Bell's palsy, or trigeminal neuralgia? What about confusion? Remember, in this question, everyone, you can put more than one answer. You can put more than one answer. You can say CVA or Bell's palsy. So is there confusion in Bell's palsy and trigeminal neuralgia and then CVA? Um, Joe and Nikki, you're correct in the way you answer. You put first the symptoms, and then you identify under which they fall. So very good, Nikki and Joe. You're doing the right thing there. And then difficulty chewing. So you can choose CVA, Bell's palsy, or trigeminal neuralgia. I'll give you more time, everybody, because I know that normally, when you're taking this test, you really have to read one by one. So I'll give you more time, guys, until all of you have processed the information. But again, okay. And I would like to welcome Leanne, Nikki Joy, Ines, and who else are watching tonight? Daja, Tanfam, okay. Audrey Sullivan. I thought Audrey already passed your NCLEX, okay. Annie Turbio. And again, for those who were not here earlier, I was stuttering a little bit. It's a little bit late. Okay. Again, my name is Mr. Alan Matus. I'm a nursing instructor, a nurse educator for so many years. I've been teaching students, past their NCLEX, and also I'm an author. I wrote a book that you can buy in Amazon, and hopefully my new edition comes out. But it's not really a lot of changes. I'm just gonna be adding your next gen. So you can still buy my book in Amazon if you want to review your content. Charmaine McGill, okay, welcome here tonight too. Mino Jacob, thank you for visiting us. All right, let's see. What's your final answers, everyone? I know in your thoughts right now you have some answers for all of these items. And again, this is correct minus wrong, so be very careful. Whatever answer you mark wrong will be deducted from the total. Okay? So ready everybody for the answer? Are you ready everyone to know the answers? Okay? Let's get ready. The answer will be okay. All right. So remember that this question, everyone, is testing your knowledge about signs and symptoms. Because sometimes as nurses, when we have cues, we have seen the cues or the signs and symptoms. Sometimes, we make mistakes, if we're not good enough in recognizing these cues and analyzing them. And it's not good if we make a mistake not knowing what's going on with our patient. What if you say Bell's palsy and it's actually CVA that's going on, right? Because these diseases have similarities. The same thing with trigeminal neuralgia, for example. So that's why the licensure examination is testing your ability to really make an inference or a diagnosis on what problem or condition the patient is having. Okay. All right, so let's go to the answer, everyone. Okay, the answer is going to be okay. Oops, the answer is right there. Okay, so your facial drooping will be for your CVA and your Bell's palsy. Who got that right? Who got right for facial drooping, guys? Okay, very good. So that would be CVA and Bell's palsy. There's no trigeminal neuralgia doesn't have facial drooping. And if you can recall your stroke has what are the symptoms of stroke? Remember that stroke you have your acronym. What's the acronym for your stroke, everyone? The acronym for stroke is going to be FAST. What's the meaning of FAST in stroke? What is fast? Facial what? Facial drooping. Okay. What is a arm weakness? Okay. What about your S? What is S? Slurring of speech. And what is T? Time to call for help. Time to call 911 or time to call your rapid response team or your stroke team. So those are the symptoms. Get Nikki Joy, good. And then or what's going on with this patient probably could also be a TIA. Do you know what a TIA is, everybody? What's the meaning of TIA? TIA is your transient ischemic attack, right? Transient ischemic attack is a temporary form of stroke, which means to say that your patient may have symptoms of stroke, but the symptoms will disappear in 24 hours. The one that's permanent is your stroke, correct? Now, what is Bell's palsy? Can someone tell me what cranial nerve is affected in Bell's palsy? What cranial nerve number is affected in your Bell's palsy, everyone? Okay, so for Bell's palsy, what cranial nerve is that? That would be your facial nerve. Okay. All right. Which is your seventh cranial nerve. Be your plus. All right. Seventh cranial nerve, and then you have slurred speech. That would be for Bell's palsy and also your CVA. Confusion would be also your CVA, and difficulty chewing, that would be for CVA, Bell's palsy, and trigeminal neuralgia. Okay, and then what else do you have there? Arm weakness. So arm weakness will be your CVA. It's not for your Bell's palsy. Okay. Trigeminal neuralgia is affecting what cranial nerve? The fifth cranial nerve. Okay. Fifth cranial nerve, and that causes the patient to have severe pain even for simple stimulation. Okay. All right. Okay. So, how many of you got, let's say, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10? 10 items, everyone. Who among you got 10? 10 items. 10 items correct. Because this is correct minus wrong, right? So, who got 10 out of 10? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If you got 10 and then you missed, for example, you put two more items, so that would be 10 minus 2. So you got only 8. So Jasmine got 7 over 10. Very good. Lily got 5. Minu got 5. Okay. Leon got 8 over 10. Very good. All right. And then, well, 7. All right, which is good. Well, in the past, in the NCLEX, like you don't have really partial credits. So now you have partial credits for the points, which is good. All right. So let's proceed to our final slide. Of course, everyone, I would like to thank you for being here tonight. But also, of course, I would just like to let you know that we have these products that you can purchase. You can just go to our website, matusnursingreview.com, if you want to have this mask. Be part of Matus Tribe. And for next week or in the next few Facebook Live, I promise that I'm going to give you more next generation questions. So probably 3 or 4. And again, remember that your next generation questions, the most important will be to know what item types you have, and then also, of course, a little bit of information about or knowledge about your scoring. So, in this question that I gave you for tonight, the more that you can click the items, you have that freedom. More likely, it's a correct minus wrong question. At the end of the day, the most important thing about your next generation, everyone, is knowing your content. So don't click anything if you're not sure, then don't click it. Okay? All right. So thank you very much, guys. I'll see you again next week and have a nice night, everybody. So let's click thank you. All right. Thank you very much, everyone.